So this final report will include the results of all your lab tests with an interpretation of what each test means and how they correlate to your symptoms. I'll make specific suggestions on how to address any imbalances and the means of recovering your health and vitality. This report will include a complete list of nutrients and dietary recommendations and possibly a prescription. Any products ordered from us or from our compounding pharmacy will be a separate cost. All the products that we sell are very competitively priced, and there's no obligation to buy from us. Follow-ups, actually, if you want to see a copy or a sample of that final report to give you an idea of how that's organized, how it's interpreted, you can again click on that the one part down there, the final report. Follow-ups are usually within 6 weeks from the first exchange, and that'll be also charged separately. I'll include more information about this when you receive your first free summary. We'll also include information about insurance on that first free summary. We will arrange for follow-up lab testing, usually anywhere from 30 to 60 to 90 days out from the first test. Depends upon what tests are coming back abnormal, how far out of range the results of your blood tests are. My vision of this service was to reach, or is to reach, thousands and thousands of people. And I know that working on that grand of a scale of delivering healthcare, especially over the internet, for it to work, it's necessary to become somewhat automated. And this thought has kind of kept me from going in this direction, because in my practice, it's always been on a one-to-one basis and fairly intimate with my patients, because I am a holistic physician. I realize all the dimensions and all the levels of the reasons for a person expressing ill health. You can't just spend 15-20 minutes and just look at lab tests and expect to help the person to resolve or to regain their health again. So I was a little uncertain about how we could offer something more personal like phone conversations, and I was reluctant, but I want to give it a try. So to begin with, we're going to schedule phone consultations for those of you who have more personal needs or simply prefer a more personalized service or attention. Scheduling will be 15-minute slots as well as 30-minute slots, and we're charging $50 for every 15 minutes. We have receptionists who will make your appointments, and that contact information will be included in your final report. I am absolutely certain that what we're offering here is far superior to what you can receive from 90% of the clinics out there. And I think this is for a couple of reasons. First of all, they don't have the time to understand or to review all the details of your condition and what are related symptoms to your condition. And most of the time, doctors want to focus on your chief complaint, your main problem. And those things that seem extraneous to them are irrelevant. And this is unfortunate, because those apparently irrelevant symptoms are often the keys to understanding the complexity and the reasons why you're not well. That's the first reason. So through the questionnaire that I will send you for free, which is about 60 questions or maybe 70 questions altogether, can you imagine a physician taking the time on a one-to-one basis in the clinic and then going through 70 questions? It's impossible. But the way I've set up the questionnaire, it's very easy to quickly understand where the problems are. And it's usually not just one problem, it's several problems. Where are the problems and how do they relate to each other? You cannot do that in a clinical setting. I spend 2 hours, sometimes 3 hours with one patient. You can't find that approach in a clinic, MD, medical doctor clinic setting these days. It's inefficient. It really doesn't make much sense, especially if their primarily prescription is pharmaceutical. Even for me to spend that much time, it's not very cost effective. And yet I can gather information from you through this questionnaire, which would take me an hour to hour and a half. I can get it done and scanned and assessed fairly quickly, probably within about 5 minutes, somewhere in there, and to know where to go with the types of further information that I need through lab tests. So that's the first thing that makes us, I think, able to give high quality healthcare to a large number of people. The second is because in the clinic setting, most of the time the doctor's encumbered, their hands are tied by what they think the insurance company is going to be willing to pay for as far as lab tests are concerned. I have chosen not to work with insurance companies for a number of reasons. Partly because if I order tests that I feel are essential and the insurance company comes back to me and says, I'm sorry, we cannot, under this CPT code that you've given us, we will not cover those 2 tests. It turns out that when insurance companies bill me, or have to eventually bill, because I got to pass that bill along to you, it is very expensive. And we don't want to be in that position of having to pass a huge lab bill onto a patient when we were the one to order it. Sense of feeling responsible for that, and they can be huge. What costs often doctors, if we pay it outright to a lab for a test that might be $50, often, if it's not covered by the insurance company, it'll come back to us $300 to $500 for that test, and the insurance company will not let go of needing that cash that to be paid for. So doctors are very hesitant. Their hands are tied again by the insurance companies about what they will cover as far as testing. So I'm not laying the blame here for some inadequate diagnosis going on when doctors are really the middlemen between you and the insurance companies, and I'm not blaming them for being in that uncomfortable position.